Morning, guys. It's Jason with
Luke,
and
the coolest CJ ever.
so I just wanted to go over some reminders, some protocols on our COVID protocols for the office. So we're getting into a really unique time, and we're starting to see some schools uh, close down and do everything remotely. There's a fear that there's some businesses that are going to be shut down. So I thought it was a good time to send out a reminder to everyone that nothing's changed with our office. We're still at the forefront of following all the CDC guidelines and going above and beyond um, our COVID-19 protocols in terms of keeping things as safe as possible. So I'm going to go through this quick video and narrate it just so I can better educate everyone to make sure that they're fully aware of what we're doing. So let's see if I can play this. Oop, maybe I can't. Let's see. There we go. All right, so let's see here. So obviously we have mobile check-in. There's signs in front of each office, okay? Um, why are we doing mobile check-in? Well, the goal is to keep as few people in the office as possible. So I'm going to pause it here. By you texting us or calling us when you get to the office for your appointment, you stay in your car, and our front desk team will reach out to you as soon as we're ready for you in the office. By doing this, it keeps the total number of people in the office at a minimal level, which ultimately reduces any possible risk of infection. The other thing that we're doing is having specific COVID-19 questionnaire protocols to make sure that people have not subjected themselves to the possibility of infection and possibility of bringing that into the office. So, excuse me. So everyone will get either a digital questionnaire, or if they don't have access to a smartphone, then they'll fill it out before they come into the office, of making sure that they don't have any symptoms of COVID, making sure that they haven't been out of the state or on the list that New York State considers a place where you need to quarantine for 2 weeks. This protocol has really helped us out. Here's the protocol here. This protocol has really helped us out here because if anyone checks yes, then there's an action item. There's a flow chart that needs to be followed, and we have had many times patients where we had to say no, that we couldn't see them because we were not going to risk the possibility of them bringing in anything to our facilities that we didn't want. And there's Ann saying that we'll call you as soon as we're ready. So stay in your car. Don't come into the reception area. Obviously, masks are mandatory everywhere. The staff's wearing them. We want patients wearing them. Patients will wear them all the way to the chair. And then I'll show you here in a few seconds that the assistant, the hygienist, the doctor will tell you when to remove them. There's hand sanitizer everywhere, both at check-in in the rooms. We want people using the hand sanitizer at check-in, like Beth is showing here with one of our patients, taking temperatures on every single patient, making sure that there's no chance of any fever, recording that, and then obviously allowing the patient to come in. You can see our reception area is completely empty. We have air purifiers everywhere, which both in the larger areas of the office and in the smaller treatment rooms, these air purifiers are state of the art. They recirculate the air every 10 to 15 minutes. The filters in these air purifiers are specific for the molecule size of the COVID-19 virus. They're constantly recycling the air. It's pretty amazing. Actually, we got some for our house too.
You did?
In the bedrooms. Hand washing protocols, obviously for the staff. Hand sanitizers. This is Beth again with that same patient. We have a pre-rinse protocol where we want the patient to rinse with a solution that is recommended by the Center for Disease Control. and it's a 30-second rinse and then spit. Some patients aren't crazy about this, but again, our goal is to ultimately create the safest environment possible. So this pre-rinse could reduce, if the patient had any type of coronavirus in their mouth, could reduce the load in their mouth to an amount that was not efficacious to infect anyone. After the patient leaves, there's a picture of Selena just making sure that everything is spotless. There's so many areas in the dental office that uh, need to be controlled. So we have lists so we're getting every little nook and cranny. This is a video of Kaylee, who's one of our awesome assistants in the Canandaigua office, fogging the room with hypochlorous acid. I've mentioned before some videos on hypochlorous acid. This has been the most efficacious solution. Again, Center for Disease Control recommended. So we spray down the room all the time. This mist will ultimately kill any bacteria that's in the air, and then it ultimately lands on surfaces. It'll kill
Everything.
kills a lot of things. Kills any bacteria that's on, or viruses that are on the surface, and it's really cool because it dries and leaves no residue. It's something that we use in our own home on everything from countertops to exercise equipment to some of the food that we're eating that we get from the store. So it's very safe, but it works very well as well.
You can eat it.
You can eat it.
Don't recommend. Don't let it touch the roof of your mouth. It's like spicy and weird.
Spicy and weird. Here's Renee, one of our awesome hygienists out of the Canandaigua office, going through our operatory disinfectant task list. And the reason that we put this up, it's very similar to a checklist that a surgeon uses before they go into surgery. It's very similar to a checklist that an airline pilot would use before they take off. Yes, a lot of this stuff is obvious, but I want to make sure that no stone can be left unturned, that every team member understands exactly what needs to be done after every appointment. So everything from countertops to floors to hosing to x-ray heads, everything is wiped down, everything is spotless everything is fogged before we would consider bringing another patient back to the room. And then obvious things that you're seeing at all these different businesses in places where you go out. There's 6 feet social distancing. We have everything's marked where we wouldn't allow patients to get closer than ideal. You can see most of you guys that have come to the offices before COVID, it's a little bit busier than this. So we're just doing everything that we possibly can to keep the numbers down, to use social distancing to make sure that there's no possible way or extremely reduced way of anything coming. And then it's good to know that some patients are receptive to what we're doing. So we've gotten a number of Google reviews over the last few months of patients that are super excited about the precautions that we're taking, the COVID-19, the coronavirus precautions that we're taking. So I really appreciate that it's being recognized by many of our patients. I just wanted to communicate to all of our patients that we're doing everything that we possibly can, going above and beyond to keep you safe. We're fortunate enough that no one on our team has been infected with COVID, and I think a lot of that has to do with the precautions that we're taking. So reach out if you have any questions or concerns. Thank you.